GP who works at Hull Prison and Long Lartin. I first started working in prison health in January 2009. I chose to work in prison health because I worked in police custody suites and have done for the past 3-4 years now, and it seemed like a natural extension of working in that custodial setting to go into another custodial setting. I suppose I expected it to be a little bit like the police stations that I was used to working in that, you know, I was used to being around people who were accused of various things. So I expected it to be a little bit confusing because I didn't know the layout of the place. But the work, I suppose I expected to be relatively similar and normal to what I was used to. More so the sort of disorientation of the place and not understanding security aspects of safety and things like that, really. How did I feel after my first day? I suppose exhilarated in a way. It was what I expected it to be. They're a group of people who we're used to dealing with in the community, but they're all together in one place. So whereas in a normal general practice you may well have 1 or 2 recurrent people who were in and out of prison, here we've got, I think it's about 1,600, something like that. So a concentrated group of the sorts of people that you are used to seeing, just not time after time after time, which you get here. So actually it was exactly the same as like police custody and occasional bits of general practice. The biggest myth of working in prisons is that it's not a ridiculously scary place to work. I suppose depending on who you talk to and their upbringing and their work-life history, you may well think that this place is a very scary place to work because of the sort of people that you have in here. However, it isn't really. You know, there are obviously a lot of criminals in here for various serious crimes, but their beef, if they have one, is with the system that's put them into prison, not necessarily with healthcare. So it's not that scary. I mean, you do have to have your wits about you, obviously, and think, but certainly I've never seen any overt violence or anything in here. And as I said earlier, I work in Long Lartin prison, which is, you know, it's maximum security, and if anything, it's even less in there than it is here. So I think the biggest myth is that it's a violent, dangerous place to be. I would argue there probably isn't any difference, it's just that it's more concentrated. So whereas, you know, being a GP, in normal general practice you would have a few people who are schizophrenic spread throughout the practice, or a few people who are psychotic, or you know, a few people who are chronic alcoholics and a couple of drug abusers. They're all concentrated in here. So you don't get the little old lady who's got a few problems with this, that or anything else. You get concentrated versions of a normal population of practice patients. So obviously there's a spread of you know, drug abusers, alcoholics, mentally ill, so, you know, not just the sort of normal depression and anxiety, which is obviously very common on people coming into prison, but, you know, there's serious mental illnesses, schizophrenia, etc. You know, there's a big concentration of that group. Equally, not wanting to scare anybody, there's a lot of diabetics and asthmatics and coronary heart disease patients, epileptics. You know, I've seen a few diabetics this morning, some epileptics that have been fitting, a man with angina. I haven't actually seen any drug addicts this morning. So, you know, it's one of those things that just changes all the time. You can have a morning of seeing drug addicts, drug abusers and alcoholics, and then other mornings you just, you know, see run-of-the-mill diabetic problems and asthma problems and coughs and colds and ingrown toenails and all those normal things. So it's exactly the same as a normal practice. It's just concentrated group of men in this prison at Long Lartin with those sorts of issues. I'm thinking of someone I'm seeing tomorrow who's got asthma, who is you know, in prison for life. So, you know, you do get to build a relationship with quite a few other different people here as well. which is quite nice for for GPs really, because that's what we're used to doing outside of the prison walls, and it's exactly the same in here. Yes, there's a big throughput such as out of hours and walk-in centre type stuff, but equally there are a lot of people that hang around that you do end up seeing and getting to know, which is nice actually. And I suppose that can be quite challenging sometimes when people want something, and whilst they might be able to get it in the community, it's not allowed in here, and that causes quite a lot of problems. That tends to be around controlled drugs. What skills do you need to work in a prison? I think basically just normal general practice skills really. You need to be able to communicate as well as possible with people, and try to get them to understand that you are bound by rules just as much as they are, and try and develop those normal working relationships like you do in the community. I mean, obviously that's easier to do with people that you're going to see again and again, whereas the remand population or the short sentence population, again, a very transient group. I personally like dealing with alcoholics. I think they get a very bad service generally within the NHS, and I quite like dealing with them, as I do in police stations. I think they're a relatively misunderstood group who need a lot of help and support. Essentially it is exactly general practice, but with a different group of people in a different place to normal, where you've got a big bunch of keys on your belt